All right, the last little segment that we need to talk about here has to do with allergies and some things that can go wrong with the immune system, including the disease of AIDS. Allergies are basically overreactions of the immune system. For whatever reason, especially the nasal cavity gets exposed to antigens that are foreign, but for whatever reason, instead of doing its normal reaction, it's a very heightened reaction. As a result, the tissues of the nasal cavity release a lot of amounts of histamine, which increases both the flow of blood and fluids in those areas. And this is what produces our sneezing, our runny eyes, and our runny nose. What we do is we take medications called antihistamines to actually counteract those effects. Now, these are the types of allergies that we, in describing are typically like the tree pollen, but we can also have slightly different types of allergic reactions to things and antigens in food and other environmental factors that can create things like skin hives. They can actually cause anaphylactic shock. So the body can react very, very badly to some of these antigens, and we're not exactly sure why. Kind of another overreaction, but in a different sense, is the autoimmune diseases. And this is where the immune system attacks the body's own cells. So it kind of goes haywire and overreacts, and oftentimes there's a trigger that happens there. And that trigger will happen every single time. Well, not every single time, but every single time that trigger happens, you will get one of these diseases. One of the examples of an autoimmune disease is juvenile onset diabetes. This is the one where you actually have to take the insulin shots, because what has happened is your body's immune system has actually killed off your insulin producing cells. Remember, in the other type of diabetes, the insulin levels are fine. It's the cells that don't respond. So that's not an autoimmune disease. We also, in addition, had talked about the autoimmune disease of rheumatoid arthritis during the skeletal system, where the cells in the joints are attacked, and that actually creates a lot of pain with performing certain tasks. Another one that we had discussed previously is multiple sclerosis. And we discussed this with the nervous system, because what happens is the immune system attacks the myelin sheath around nerve fibers, and that causes nerve damage. One of the big viruses that people deal with, or big diseases that creates a compromise in the immune system, is AIDS. And AIDS stands for Acquired Immune Deficiency Syndrome. What happens with AIDS is the cells of the immune system, the helper T cells, are weakened by an infection of a virus called HIV, human immunovirus. Now, people don't usually die of AIDS itself. What they do die of, though, are some unusual infections that they normally would get over, things like pneumonia or cancer. So when you look at somebody who's died as a result of their immune system getting compromised by AIDS, what they actually are listed as, AIDS-related pneumonia or AIDS-related cancer. They don't actually die of AIDS itself. It's something else that kills them, but it's something that if they had had a healthy immune system, they had a better chance at fighting. Now, HIV is a virus that remains dormant for a very long period of time. It doesn't instantaneously make you sick. So HIV is the virus that causes the disease of AIDS. And as you guys know, it is spread by IV needles, sexual contact, and exchange of body fluids with cells. And I actually had a student of mine that he was adopted from Romania, he and his sister, and they actually have HIV. And it's as a result of the orphanage where they were. When they were given their vaccinations, they did not change the needles when they went from child to child. They would use the needles for multiple children at one time, giving the vaccination. So he and his sister both contracted the HIV virus. And he used to come into my classes and actually talk about living with the virus and the medication schedule and the whole management of his disease. It's pretty complicated. This is not an easy disease to live with. And back when the AIDS epidemic first started, so much of the misinformation that was out there really caused a lot of panic, to the point where, having HIV was a very big secret that you had to keep. And that was one of the problems with it, because initially it started as things, you had to be very secretive about it. There was a boy outside of Chicago whose name was Ryan White, and he actually was discovered to be having, that he had HIV and AIDS, well, HIV, and the school board actually voted to prevent him from attending school, and it resulted in this very big lawsuit. Now, this boy had gotten HIV through a contaminated blood product. Again, when the AIDS epidemic first started, there was a contamination of our donated blood supply. That has since been fixed, but initially we didn't have enough testing and enough rigorous testing in place to prevent that from happening. And this child had the disease hemophilia, where he needed pretty regular blood transfusions or blood product transfusions in order to manage his hemophilia. Now, we knew about this virus since the 1930s. We actually isolated it in 1971. So why all of a sudden in the late 80s, or the mid, in the 80s, did this become a problem? Well, there's a couple things happening. First of all, we, of course, in the late 60s, early 70s, we kind of had that sexual revolution. Well, but by the early 80s, we had women really re-entering the workforce, earning their own money, kind of taking their own reproductive rights into account. And it also didn't help that the club scene with cocaine and a lot of the drugs were readily available. So we had a lot of people living very flamboyant lifestyles, and it led to a lot of people having multiple sexual partners, and they weren't always honest about their sexual history or who their partners were. So we ended up having this spread of this disease happening very, very quickly. If you think about today, with you turn on the newscast, you get word of the war in Afghanistan and Iraq on a daily basis. The leading news stories for this period of time was about the AIDS epidemic. Every single night something about that was on, and it was a really scary time. Now, fortunately, with education in this country, we've been actually able to kind of turn the tide, and things have kind of leveled off in terms of that. However, other areas of the world aren't so lucky. Africa, for example, is the area where HIV is spreading at a faster rate. So a lot of these countries are very poor. They can't afford these expensive drugs that help prevent the HIV virus from spreading. So this is something that we're going to have to be dealing with on a global level. And they have a lot of this misinformation out there. There's men that in Africa that believe by having sex with a virgin, they can actually cure themselves of the HIV virus and prevent from getting AIDS. Well, what's happening is they're going out and they're actually raping young teenage girls and instead spreading the disease. Because of they don't have access to testing, oftentimes the first time somebody finds out that they have HIV themselves is as they're caring for a loved one who's also dying from the AIDS virus or the AIDS disease. So it's a very traumatic time. Unfortunately, there's not a lot of publicity about this, and it's going to continue to be a real problem until we start devoting some resources to it. This is a picture, so to speak, of the HIV virus, and this is what we call the capsid portion of the HIV virus. Those little looking like hairy dried out Cheerios on its surface are the antigens that are on the surface of the virus. And initially the drugs that we created were made to try to attack those antigens. The problem is the HIV virus mutates very quickly, and in a very short amount of time, the genetic material that makes the proteins on that surface changes. So the proteins can change. So the drugs aren't as effective. What we've had some success with in terms of HIV medications is actually developing medications that can block the reproduction and growth of the virus itself. This is a cell that's been infected with HIV, and these little packets here that are being given off are more virus. So those little black spots in there are supposed to be little bits of the HIV virus. And you can see back in the cell, it's just getting packed with more and more of the virus. Now, this is one of those helper T cells. Okay, this is kind of like a healthy one. And this is one that's been attacked by HIV. HIV doesn't we talked about viruses being like little mosquitoes that kind of come and land on you and they inject their genetic material and kind of hijack the cell. Well, HIV doesn't operate by just having one virus attack. It kind of gang tackles a cell, as you can see here. So this is one of the reasons why the progression of the disease is very, very slow. At this point, you can actually go and answer the questions with the AIDS simulation activity that you have. In addition, there are some review questions that you can answer. And this concludes our lymphatic system.